Welcome to a special series of This Week in Canton City Schools, where we'll focus on the mental health and wellness of our kids and families. I'm Jacqueline Power, the Broadcast Media Program Instructor here at the Timken Career Campus of McKinley High School, and your host today. The Canton City School District continues to partner with the Child and Adolescent Behavioral Health Agency. This agency provides a myriad of resources to Stark County community and, most importantly, to our students within CCSD. Each month, we will feature resources and strategies to help the mental well-being of our young people. On this episode, we are talking with Dr. Elizabeth Hayford of Psychiatric Services Medical Department of the Child and Adolescent Behavioral Agency. Sit tight, all of that starts right now. As we continue to look for ways to have a healthy, happy, balanced lifestyle, there's no greater need than to work alongside our mental health and wellness to meet the unique needs of our changing world around us. This series of shows with the Child and Adolescent Behavioral Health Agency will feature all kinds of different ways to address some of the common setbacks we face today. On today's episode, we have Dr. Elizabeth Hayford of the Psychiatric Services through their medical department through the Child and Adolescent Behavioral Agency. So thank you so much for being here today. We'll kind of start off with telling me a little bit about yourself, where you grew up, and what college you went to.
Sure. So thank you for having me today.
Yeah.
I am from a small town in central Ohio. It's called Fredericktown. It's so small that I think it could fit, like everybody in the community could fit in McKinley High School.
Oh my gosh, that is small.
Yes. And then I went to college at YSU, Youngstown State, and was part of the NeoMed consortium. I'm not sure if you've heard of them. Yeah, so I did that. And then actually I did family medicine before I did psychiatry. So I did residency in South Carolina because I love Ohio and was afraid that if I did residency here, I would never leave. And so
take advantage of the opportunity or residency somewhere else.
Yep, exactly. But I do love Ohio, so we came back, and I was in practice for a couple years. But my favorite people to see were those who struggle with depression and anxiety. And so I went back to school and focused on psychiatry.
That's a long list of education. That's a lot of schooling. So how did that then lead into you first becoming affiliated with Child and Adolescent Behavioral Health? And what positives have you held with, or positions, you held with the agency?
So during Child and Adolescent Fellowship, I got to meet Dr. Gersovich, who is my mentor. He's a psychiatrist in Northeast Ohio, and he was one of the teachers at the fellowship, and he was actively looking for a medical director at Child and Adolescent Behavioral Health. And when I had done part of my fellowship, I loved the community mental health, and so it was a really good fit, and that's how I ended up at Child and Adolescent Behavioral Health, and I have only served as the medical director since I've been there.
I feel like a lot of our guests that we've had as far as child and adolescent, that it's like somehow these paths have crossed, and it's just like this happy coincidence almost that like these positions have become available. So provide me an outline of the services your department provides, and are those services only offered at the Belden office location?
Sure. So we in the medical department, we'll do psychiatric evaluation if you're first coming in, needing to figure out if medication is appropriate, and then we provide medical management, and we have medical management at both our Belden office and our Alliance office.
Okay. And then describe for our viewers the age groups that your department works with.
So we see a big age range. The youngest patient I have or client that I have is 4, and we'll see clients up to 18 as long as they're still in high school.
Okay. And if you decide that a client needs to receive medication, is the client also working with a clinical therapist as well?
So often, yes, but not necessarily. We also have qualified mental health specialists or case managers who they might be partnered with, or peer support. So it doesn't specifically have to be a therapist, but usually medication is just one piece of the puzzle for mental health care.
Right. And in the past, stories have circulated that too many kids are placed on medication for specifically ADHD and some other medical conditions. Do you feel this that took place, and what process do you use to make sure only clients correctly diagnosed with the need for medication actually receive medication?
So yes and no.
Okay.
I think it depends on where you're looking. I think, yes, sometimes people were just sort of blankly put on medication, but at the same time, I think actually some people are probably not given medication that could benefit from it. Okay. So we, especially for an ADHD diagnosis, will try to get collateral information from their parents or guardians, from the school. We'll have them complete different forms to check symptoms and make sure that we're making an appropriate diagnosis.
Is CNA the only medical provider for psychiatric services in Stark County, and do you receive referrals, and from who?
Sure. So we are the only facility that focuses primarily on children. Okay. Due to the increased need, other agencies are looking to expand their capacity to accept children, but child and adolescent really focuses on kids.
On kids, okay. So I'm a parent. I have two little girls at home, not so little anymore. My 15-and-a-half-year-old just got her permit.
Oh boy.
So, right, yeah. Joy to that, I might need some services.
Sure.
And maybe my child may need some type of medication for depression or ADHD. What is a process a parent like myself can expect to go through when calling CNA on behalf of my child?
So you're going to call our number, and I can give it to you now and at the end.
Okay.
So it's 333-433-6075,
okay.
And ask for intake, and then they can ask a series of questions and determine if you need what's called an intake evaluation, where you'd see your child would see a psychologist, and then determine if it would be appropriate to go to the medical department, or depending on the situation, maybe you would just be directed to the medical department, and then it would be usually it's about an hour-and-a-half evaluation and a conversation of are medications appropriate or not.
Okay. And within that department, how many staff members are in your department, and what does each person's role kind of take on as they work through that?
We have 3 psychiatric mental health nurse practitioners. 2 of them are full-time at 40 hours a week, and 1 is part-time at 24 hours a week. And they see clients, so they'll be doing psychiatric evaluations and medication management. And then we have a nurse, Meredith Scotcher. She's been there almost 30 years, a long time. Yes.
It's a wealth of knowledge.
Yes, yes, she is, just like you said, a wealth of knowledge. And then we have a medical scheduler who gets you set up for your next appointment.
Okay. So after kind of that initial intake and they've gone through their process, when a client returns for follow-up appointments, is the client always seeing you or a member of your team after the initial evaluation and diagnosis?
So we really do try to connect the person to the prescriber that they saw, but if I'm not available, or we've got Leslie, Tiffany, and Lorna, one of them are not available, then we see each other's clients, but we really do try to keep you with your initial prescriber.
Just to kind of keep maybe some of that consistency. I would think that consistency is just as much as an important piece of the puzzle as it is like diagnosing and getting to the root of it, right?
Yeah, especially for children, because it's hard to open up about vulnerable things, and so you want to trust the adult that you're talking with.
Yeah. So what is the average wait time for a new client to see you or someone in your department?
So it really varies. If there's not too much of a line, I guess, it could be as quick as a month. Depending on how many referrals we get, it could be a couple months. We just got 24 referrals on Monday, so that'll be a little bit of a wait.
Yeah, just kind of sifting through and making sure you meet each client's needs, and you don't want to rush anybody along, and then there's only so many people. So
Correct.
So call ahead.
Yes.
And you will get in, just patience, a little bit of patience.
Exactly.
I guess before I kind of move on, if I do have to wait, so I call and I would like to get my daughter in the meantime, before they can see someone, is there really anything that I can be doing as a mom to kind of work through some of the things that I'm concerned about, or just kind of wait for the professionals to diagnose and then we move forward?
Oh, no, I think as a parent, because I've got a teenager and a mid-teen, or an almost teen.
Yeah, me too. Mine are the same. Yeah, that's exactly what I have.
And then a 5-year-old. I think talking with them and being observant, looking, is this their usual behavior, trying to meet them where they're at, and ask questions in a non-judgmental fashion, like, hey, I'm concerned about you. What's going on? Or can we talk about it? So you don't have to wait for the professional to pour into your child. And if there is like an emergency, if somebody is really suicidal or something like that, you could always call 988, which is a mobile crisis.
Okay.
Yeah.
So that's good to know. I guess as a parent, I always think in the parent spot first and think, like, what can I be doing to provide for my kids before I kind of pass them along to the professionals.
Yeah.
So that's good advice. So has your department services seen a dramatic increase in the last few years related to the pandemic? So I'm guessing that's a yes.
Yes. Yeah. In some ways, it's almost doubled how many kids we're servicing in the medical department. It's quite a big need, which in some ways is good, that there's more awareness and less stigma. So
I think overcoming that stigma is kind of our first step in, like, really taking a look, that internal look at our mental and emotional well-being, because it will impact us forever. So I feel like that's a good first step for everyone in that pandemic. I think just like put a big spotlight on it.
Yes.
How long would a child be under the care of psychiatric services?
So it really sort of depends on the diagnosis. If it's something like anxiety and the level of anxiety, it could be as short as 6 months to a year. If it's more chronic in nature, it could be 5+. We really try to work with each family, and if their pediatrician or family care provider feels comfortable to take over their medicine, then we're certainly happy to send them back to their primary care provider. But if not, we're happy to see them and take care of them as well.
So what process or evaluation process does your department use when releasing a child from taking medication, and how do you prep the child to be medicine-free?
So it's really a conversation. And what I tell people is that, so I sort of liken myself to a shoe fitter. Medication is sort of like shoes. You don't have to wear shoes to do life, but sometimes it can make things easier. So just like if you're living in Ohio and it's snowy outside, hopefully you don't wear flip-flops or try to climb a mountain in flip-flops, and hopefully you wouldn't go to the beach in mountain boots. I want to give the right medicine for the right diagnosis at the right dosage, and so then we're every 6 months to a year monitoring, can we come off? Can we go down on the dose? Are we meeting the needs? So it's a conversation.
All about the conversations.
Yes.
So finally, if a parent feels their child is struggling and needs help, what is a good number to call? And we can go over the website too.
Yeah. So the number again is 330-433-6075. And that's our Belden office. Yes. Thank you.
So thank you so much for all the information and all those resources. So as always, there's tons of resources on the CNA website that you can go there as a parent, as a community member. So thank you so much for being here today. I appreciate it. And then again, for more information on this topic and so many other topics that we've covered so far in our series, visit the CNA website at www.childandadolescent.org or call the CNA office at 330-433-6075. As always, thanks to Dan Mucci, Marketing and Development Coordinator of the Mission Advancement of Child and Adolescent Behavioral Health, for helping to coordinate this episode, past episodes, and future episodes in this partnership. As for the TV11 staff, we will continue to bring you an inside look at the district each week during the regular school year, in addition to this series of shows on mental health and wellness. So if you're a staff member and would like to have a feature story on our program, please email me at power_j@ccsdistrict.org and our station administrator, Bill Widener, at widener_b@ccsdistrict.org. We'd love to have you into the studio to showcase the valuable experiences our kids have here at the Canton City School District and the supports we have in place to educate the whole child. Please visit our website at CCS TV11, where you can get information on all of our shows and watch us on your favorite device. I'll see you next time.